So moving forward to the next group of MCQs which may be asked, let us talk about a little bit about non-communicable disease. So non-communicable diseases from PGI entrance point of view, see, non-communicable disease consists of like hypertension, rheumatic fever, coronary artery disease, stroke, and cancers and blindness and all these things, and of course goiter. So from NCD, from PGI entrance exam point of view, I have seen that most of the questions are from three different areas. Like they'll talk about ophthalmology or blindness, questions from blindness, or related questions from ophthalmology or National Program for Control of Blindness. Second is a frequently asked question on hypertension or stroke or obesity. And third is another frequently asked question on cancer updates or questions from cancer. So these are your three gross areas where you need to work on from community medicine point of view for your PG entrance exam. So having said so, let us move forward and discuss a few MCQs from each of the topics. If we talk of the question number 32, blindness can be seen in measles, mumps, rubella, or Coxsackie virus or CMV infection. So what do you think blindness can be seen in? Blindness is a disease, like blindness is a disorder where the person cannot see. So first is you should know what is the classification or the WHO categorization for blindness. WHO says any vision which is less than 3/60 will be known as blind. So what is blindness according to WHO? WHO or the NPCB, National Program for Control of Blindness, National Program for Control of Blindness. So both now have the same categorization. Earlier it was different for NPCB and it was different for the WHO, but now it is same 3/60 for blindness. Point number 2. If you talk of, let us take each of the topic and let us say what are the manifestations. If you talk of measles, let me talk of first of measles. If you talk about measles, please remember that measles is a disease which is characterized by rash and fever and all these things. But do you know that conjunctivitis is a very often associated ophthalmic disease, very often associated ophthalmic complication with measles. So it is related in 80 to 99% of cases do get conjunctivitis. Apart from this conjunctivitis, there is also chances of patient to get keratitis. Then there is corneal scarring, retinopathy, optic neuritis, and all these things. So corneal scarring, keratitis, retinopathy, all these are usually associated with measles. So in a sense to say that can there be blindness in measles? Of course there can be blindness in measles. Next, if you talk about mumps, if you talk about the second disease, that is mumps. In mumps there is not very often, but there is a chance of visual impairment, and literature says that the visual impairment in mumps is roughly in tune of 15 to 30%. So that's a quite a big number. So 1/3 of the patient, roughly around 1/10 to 1/3 of the patient do get visual impairment in terms of transient. These are transient cortical blindnesses or associated transient cortical blindness, and there could be neurological involvement of cerebellar ataxia as well. So plus minus cerebellar ataxia. So it's not very often, but it's like it is there. Visual impairment literature says that it is there with mumps. Third is about the rubella vaccine. If you talk about the rubella vaccine or rubella disease, if you talk about the rubella disease now, in rubella, I think everybody knows that very often there is chances of getting rubella, congenital rubella syndrome. So what is CRS, congenital rubella syndrome? It consists of three things, that is cardiac, that is deafness, and ophthalmic problems. So what about the cardiac diseases? CRS is congenital rubella syndrome. So cardiac malformations which can occur is most often there is most common is PDA. Most common it is PDA. Apart from PDA, there could be chances of interventricular septal defects, interventricular septal defects, or pulmonic stenosis. In terms of for hearing or deafness, there is sensory neural hearing loss, and for ophthalmic involvement, in eye involvement, there is chorioretinitis, chorioretinitis, and the child who's suffering from congenital rubella syndrome will get a smaller eye microphthalmia with cataracts. So cataracts is common. So please remember there is lens involvement in congenital rubella syndrome. There is like the cell nucleus in the embryonic nucleus is retained in the cell. So there is lens involvement. We can write it down for your exams. The lens features in congenital rubella syndrome. There is first is please remember there is retained cell nuclei in embryonic nuclei. Another feature with the ophthalmic involvement could be necrosis of iris pigment epithelium. So please remember that there is lens involvement with the retained embryonic nucleus. Second is you need to remember iris involvement, iris pigmentary involvement. Third is microphthalmia, cataract, chorioretinitis, along with cardiac defects and interventricular septal defects or pulmonic stenosis or the patent ductus arteriosus. So that is like rubella is very often associated with ophthalmic involvement. Do you know that you can also remember this, that in case, what is the most common ophthalmic involvement? Most common ophthalmic involvement or complication in case of MCQ, in case of acquired rubella is different. In case of acquired rubella infections, very often we get patients who are suffering from acquired rubella will get conjunctivitis. And in case of congenital rubella, please remember in case of congenital rubella syndrome, the most often is pigmentary retinopathy. There is retinopathy, just remember retinopathy, and second followed by that there is congenital cataract or glaucoma. So but please remember for your MCQ exams, most common in rubella there is conjunctivitis, and in congenital there is retinopathy. So that's all for measles, mumps, rubella and Coxsackie. Let's talk of another thing, that is Coxsackie. See, Coxsackie virus is known to cause hand, foot and mouth disease. Hand, foot and mouth disease. This virus will cause a feature like this. So if you see this picture, it shows a clear picture of hand, foot and mouth disease. This is small petechial rashes, and this Coxsackie virus hand, foot, mouth disease is a self-limiting disease with recovery in approximately 7 to 10 days. And this is like contagious disease which spreads on touch, and the involvement of ophthalmic involvement is not reported with Coxsackie. So it is very like not reported. There is no evidence of ophthalmic involvement. So Coxsackie is one disease which is outside. Next is we have about CMV. Next is talking about the CMV. CMV, I think everybody knows. Quite a lot of questions have already been asked. CMV is cytomegalovirus. It's a type of herpes virus, and CMV causes, first is retinitis. CMV retinitis. Second, what is the pathophysiology like? How does it cause a retinitis? See, CMV virus promotes, it's a type of herpes virus. It promotes vascular endothelial growth factors. So it promotes the presence of VEGF, vasculoendothelial growth factors, which have a property of course, neovascularization. So, of course, if you understand that there is new vessel formation in the retina, this causes retinal tissue destruction and neovascularization, which further leads to retinal tissue destruction and neovascularization, which causes a wet type of which may lead to a wet type of ARMD or may lead to retinopathy. So this is what is the ophthalmic involvement in cases of CMV infection. So having said this, if you come back to this question, blindness can be seen in measles, mumps, rubella, Coxsackie, CMV. So of course I would like to mark my answer in the exam as A, B, C and E. So I would like to mark A, B, C and E. Blindness can occur in all of the following infections.